Hi there. I've made some models about how to do a cervical exam and teach other people how to do a cervical exam on labor and delivery. And my last model was confiscated, so I'm making another one. But just in case it walks again off the labor deck, I thought I would make a video so anyone else can learn how to make a model to train medical students how to do cervical vaginal exams. So I obtained everything I need for this project from Home Depot and Michael's craft store. From Home Depot, I purchased this thermoplast roof flashing for about $4. And if you kind of imagine sort of like this, it sort of resembles what it would be like to do a vaginal exam. It has a very narrow 1.5 to 2 inch opening so that it assimilates what it's like when you're doing a vaginal exam and you really can't see or feel what's going on beyond the small opening of the vagina. So I like it for that reason. I also like it because in a 2-person team, someone can be on the other side of this and the person doing the examining doesn't know which size cervix they might be quizzed about. So I purchased that at Home Depot. And then several little PVC fittings to attach to this PVC pipe. I have one fitting that will serve as the female part to go on the end, and then I have several fittings that are male parts, if you will, that can screw into that. And then what I do is make 0 to complete cervixes out of Model Magic and foam that can be interchanged so that students can be tested on what's going on. Some of the things that I purchased to mold a cervix and fetal head are from Michael's for my mid-cervical exams, 3 to 6 centimeters. I purchased these spheres, and there are 2 halves in each package. And then for 8, 9, and 10 centimeters, I purchased the larger 10 centimeter sphere to assimilate. Actually, I think it might be a little more than 10 centimeters. It's 111 millimeters. It's 11 centimeters to better assimilate what it's like to feel the cervix when the head is coming down a bit more, and you can feel more of it. And then I purchased Model Magic Pink for cervix, and I got 4 packs because I like to try to not only form the diameter of cervix that you typically would examine and feel at closed or 1 centimeter, 2 centimeters, but also a typical effacement, because I think some of the models that we use don't take effacement into consideration, and so it's really difficult for students to get a 3D impression of what that exam might be like. And I find it quite helpful to use the Model Magic for that. In case any of you didn't grow up with my mother, who did a lot of home repair work, and you haven't worked with PVC pipe before, it's really quite simple. It's kind of like a puzzle. And for this project, you really only need to actually glue the one piece on the end of the pipe. And whenever you're using PVC pipe, you always first use the primer. As you can see, this is a well-used can, to kind of prime the surface of the pipe that you're going to be gluing, as I'm doing here. Just kind of paint it on there, and that primes it so the glue will stick. You can also prime the inside of the piece that you are going to be gluing, and then you let that dry just for a minute, and then you get your glue, which my glue is a little dried up. I think it's still going to work though. So this is what the glue, this is red hot glue, PVC pipe cement. I don't really care what brand. This is just a simple little project. It's not like you're doing plumbing or anything. So anyways, you would scrub that on there, or just rub that on there, not really scrub it, and do the same thing on your innard part so that it gets nice and sticky, and then you just smush those together like so. If you're really concerned about how it looks, you can use one of your cleaning towels and just wipe around the edge to get the extra glue off, an extra primer off. I'm not too concerned about how it looks, but it's more of a functional tool, which I think is what's important for my purposes. And again, that is your male part that all of your different female parts that will be from closed to 1 centimeter, 2 centimeters can screw into. And Model Magic is magical stuff. that my kids used to love when they were little, that you can shape into any shape that you would like. So for example, for a closed cervix, I was just going to kind of imagine what that might be like and maybe make a tiny little opening over a thick, you know, closed cervixes are often, even at the end of pregnancy, still 3 centimeters long sometimes, occasionally still 4. You could even make one that's closed and one that's sort of fingertip like this. I might make this one fingertip just to have that be an example. And then you can just kind of shove that onto your PVC pipe, and then that would be your closed cervix. Now, you may not want to do the fingertip because you don't want to get them confused and make them think that's 1 centimeter, but you get the idea. For the 1 centimeter cervix, I'm just going to kind of coat the inside of this with a little bit of Model Magic, just to make it a little bit narrower, because you know 1 centimeter is about your finger. And then come around the outside so that I can actually use the pipe as part of the thickness of the cervix and have it not use up quite as much of the Model Magic, because probably the most expensive part of this project is the clay. So then I would just go around the outside like so to form a nice soft cervix for someone who's trying to palpate that you could imagine that would be about 1 centimeter. You can see what that looks like. You have to might want to be careful to be sure to leave your threads exposed that you need to use to screw back into your interchangeable wand that you're changing out to test different sizes. So now we've got kind of a closed cervix and a 1 centimeter cervix, and so on. Just as a side note, I've been standing here working. I really probably should have sealed these cans up and put them away so I'm not inhaling all the fumes the whole time I'm working. So you can see from left to right, I've got a closed cervix, 1 centimeter, 2 centimeter, 3 centimeter. I've got to mention a ruler comes in handy. I did show you the little balls from Michael's, and unfortunately they were not exactly 2 spheres. I had to cut them in half. So I didn't include that part of the video, but there was foam everywhere, and if you can find them already cut in half, that would be probably very nice for you. In order to make the head and 4 centimeter cervix be able to attach to the wand, we will call it the wand, you sort of have to figure out a way to attach your piece to it. So I'm just kind of grinding it in there, and then I'll use some glue gun. It's really loud. Some glue gun to hold it in place. Okay, so that took some time to get these little guys kind of wedged in the foam semicircle domes here. But they're all in there now, and basically I am just going to go around with the glue gun and apply. Dog Gunner, say hi. Everybody, we're making a move. Here you can see cervixes 4 through 10 from the underside with the PVC fittings glued into the half domes of styrofoam. So for cervixes 4 through 10, you basically want to make a ring of the Model Magic at the diameter, and this has been measured with my ruler to be approximately 4 centimeters. So to be exact, just to, you know, the idea is to get it close. And it doesn't have to be exactly symmetrical either, because what cervix ever is. And then you just want to go around the edge and just kind of mold that outer edge of the Model Magic on to your semicircle of foam to simulate how it would be on the patient. And that is going to start to give you an idea of the exam with the head as you're examining the patient. And typically at 4 centimeters, you're maybe, you know, this effaced. It's like 60% effaced, I would say, maybe even 80. It's, you know, it's pretty thinned out in terms of thickness. It's only about 1 centimeter. Still got some girth to it, so maybe you would say 60. But you get the idea. Okay, to take advantage of another learning opportunity, I wanted to show you, here's my 5 centimeter cervix. and I'm going to glue it on. But before I do, I just wanted to show you, I actually drew in like a mimic of a sagittal suture. And so you could, it's at 5 centimeters, unlikely you'll be able to find a fontanelle, but it's nice to give students an opportunity to imagine that they can feel that line as they're doing the exam and say, oh, well, the baby's, you know, depending on which way that line is, either, you know, LOA or ROP, for example. I didn't want to forget to mention I'm putting a little dollop of glue underneath the Model Magic, and then kind of plopping it down on the foam spheres just to be sure that it does stick. The Model Magic will dry to a solid, more solid consistency that won't stretch or change, but it will not probably stick to the foam for very long without putting a little bit of glue on there. This is my 8 centimeter cervix, and I'm just showing you how I'm just using a pen with the ballpoint in to sort of just push down the styrofoam and mold a nice posterior fontanelle by pushing down the foam and mimicking that drop off that you're supposed to be able to feel in order to help determine head position, and that's often very helpful for residents to practice with. I just want to show you one other thing that I like about using the Model Magic is that you can make a very thin layer. I was saying you can make a very thin layer that mimics, you know, like a 90% efface, where it's just paper thin. So as they're feeling that, they're going to have to really get an idea of exactly what that edge feels like. And again, I've drawn a posterior fontanelle. For the person who's holding this test cervix for a student who's checking, on the flip side, I've written posterior fontanelle, so they'll be able to move this model around and mimic different fetal head positions for residents to practice on. And also I wrote how many centimeters on each one. And you could write effacement as well if you wanted. I just wanted to show a picture of my 10 centimeter cervix, which is in truth a little over 10, but I've drawn in the anterior fontanelle and the posterior fontanelle, as well as the sagittal suture, and labeled the underside accordingly, posterior fontanelle, anterior fontanelle. The discussion about 10 centimeters versus complete really is an interesting discussion to have with residents, because obviously a cervix might be, if you were to truly measure it, dilated more than 10 centimeters, but if you could still feel the cervix, then you're not necessarily going to call that complete. You really want to be reaching up the side and not feeling the cervix at all, and feeling like the head has started to come completely through the cervix, and that's truly complete. In the end, here they are, all the way from closed 1 centimeter, 2 centimeters, 3 centimeters, 4 centimeters, 5 centimeters, 6 and 7 centimeters, and then 8, 9, and 10. And you can see as you go further along, you can have more fun drawing in those sutures. And then I just folded this semi-rigid plastic flashing to make it stand up like this, so that it can be used as a backdrop for someone to reach in and examine, while on the other side, the tester has chosen a cervix that the student will not know which one it is, and they're going to simply hold that on the other side of this and quiz the student to reach in and feel what's going on with that cervix. So that is basically how to make a model for teaching students and residents vaginal exams.